Nick. He is a trained RMT, but he's doing all sorts of other amazing things in the space, which I am very curious to learn about, as always. And I'm sure all of our listeners are going to be curious now that I've just given them a bit of a teaser that you're doing all sorts of really interesting things in the space. And our quick chat that we just had before we kind of started recording, it seems like we're very like-minded already at focusing on doing more in the health and wellness space. So David, why don't you take it away, and I'll let you do a little bit of introduction, a plug for your business, so we can kind of understand, what part of the health and wellness space you're really focused on.
Okay. Well, first of all, thank you for having me. I'm very grateful to be here. I guess a little bit to start in the background of where all of this came together for me. I began working in music, film, and television in Los Angeles, which I was in Los Angeles for 22 years, worked along with some very talented editors. And in that world, we began really looking at the human psychology of the edit and how the brain works in particular stimulation. So I guess this took me down a pathway of doing all kinds of courses in Los Angeles, trying to find my way, neuro-linguistic programming. I got into hypnosis for pain cessation. And finally, one day on a film set, I was interviewing the massage therapists that were there working with the people on set, and they told me to shut the hell up and go to the school that they went to. So I did. And so this all snowballed into growing over a long period of time, a way in which I treat manually. That after a certain period of time, I moved back. I'm born and raised in Kingston, Ontario. I moved back to help with my family. There was needs here with aging parents, etc. I'm sure we're all aware of how that works.
Yes.
And in the meantime, I began the journey into becoming an RMT here. And I guess at a certain point, as I got through the curriculum here, I found just what a wonderful combination of what I learned in a different environment, a more, well, we can get into that, but a different philosophy of how manual therapies work in one area of North America, and then a more comprehensive training became very valuable in the schooling that I did here in Ontario. Very much, I guess, a more comprehensive training here, but very valuable, I guess, is what I want to say. And then after, I guess probably about 6 months after I became an RMT, I met a doctor in Toronto at the Canadian Massage Conference that I'd been hearing about in Los Angeles, because he had designed a laser therapy tool that pro athletes were using there. And they were telling me, if you ever get back to Canada, you must meet this doctor. I did, and within 2 weeks, I was at Meditech and training in what's called photobiomodulation therapy, or cold lasers. And here we are. So I brought this to Kingston, and we're now operating 3, well, maybe by the time this airs, 4 lasers in my clinic, along with massage therapy practices.
Okay, so really interesting background. Didn't expect the California piece.
Sorry about that.
No, it's great. It's, all the guests we have, there's such diversity in the background, which is interesting. It seems to be a real common thread with, finding entrepreneurs that, there's some diversity somewhere in the background of most entrepreneurs I've been talking with. And that's really interesting for me. I'm curious about the laser, the cold laser. Tell me the benefits, because I'm not aware of it, and
Oh, okay.
I I have a thirst to know everything there is to improve my human condition, not just everybody
Okay.
else's.
Yeah. So the laser itself, I know that sounds kind of Star Trek and sci-fi, but really what we're doing is we're sending photons into the cellular space. The mitochondria inside the cell has the receptors to pick up these photons and increase adenosine triphosphate, or you've probably heard of ATP production in how, so that's a little energy powerhouse that makes the cell work. All right. So there's many conditions out there where inflammation and other factors, other traumas will decrease the cellular output. And these photons will increase that, and along with a cascade of other biochemical reactions that happen, we take down inflammation. So just to I guess give a better picture of this, we've healed diabetic ulcers and averted amputations. We've healed broken bones, right to sport injury of ligaments, muscle tissue, tendons. And that's just kind of the surface of where we're going. Michael Hamblin, Dr. Michael Hamblin at Harvard is leading research into how these photobiomodulation techniques can decrease traumatic brain injury, Alzheimer's, and dementia. Okay, so that's a world that's, and there's probably close to, well, I won't give a number, but there's a lot of papers out there on what these studies are doing, and it's been written up in the Lancet and the New England, et cetera. So we're on a cutting edge of where this therapy can go, and we haven't seen yet. I mean, we've seen great results, but we haven't seen yet where it's going to end up, which is very exciting. Yeah,
Fascinating. So, how long have you been doing this for?
So I started the laser in 2015.
Okay. So 7 years. It's a good, or six and a bit years. So that's a good run to get some quality data. When do people become aware of the benefits of this laser? And then, like, I'm really curious about the customer journey on this, because it's so niche and so progressive. How do people get to your clinic and feel like they need it? Did they find out about it and then they found out there's one in Kingston? Did they find you and you told them you had a solution for them? Yeah, like I really want to know what the journey is.
This has been a rough. It started right when, let's say, I'm shadowing at Meditech in Toronto, and I'm all excited to bring the laser to Kingston. And both Dr. Slava Kim and Dr. Khan himself, who designed the whole system, which, by the way, Canadian product, started at Ryerson University and then stayed in Toronto, but is now globally accepted. I spoke at a master class where the keynote was a neurosurgeon from South Africa. So it's really going global. But so when you get that excited and saying I'm going to bring it to Kingston, Dr. Khan kind of burst my bubble, because he said, be careful, because your excitement level, it's going to be a slow grow, because he said, basically, I know, without saying any names, I know the doctors you're going to be up against in Kingston, and it's going to be a slow build for you.
Okay.
So meaning we have a set mindset of what works and what doesn't, and to bring something new into the fold, it's not just going to get accepted right away. And of course, that's that's the way it has to be done. So
Yeah,
when people find, there are doctors now beginning to send people to me. Um, it's been one at a time. They'll test the waters and see the results, and then send more patients, and then tell other physicians. So that's one way we get people into the clinic. But the real big way is if you can just imagine having low back pain for years and you've tried everything, and then you come in and do 6 or 8 treatments in a period of 2 weeks, and you're walking straight up and you have no more pain, you're going to tell your friends, right? And
yeah.
that basically, the large percentage of people come to me is just from the success from the previous person.
Okay, so a lot of referral based.
Yeah.
Okay, okay. And how's the growth been over the last 6 years?
Fantastic. I mean, when you start with one system, and it's a financial hurdle to get over getting that system into the practice. So that's a slow thing, and I chose to do it that way instead of buying 6 lasers and just going gangbusters, because I've had that fail in the past for me in other facets of my life. So I just thought, let's just do a slow burn here and build this up, and that's how we've got ourselves to implementing the 4th laser now very shortly.
Okay,
Um,
that's
okay,
amazing.
so,
Good
yeah,
for you. So there's a big education curve for sure.
there is, yes.
Yeah,
Yeah.
yeah. I mean, I think it sounds like they're like, I don't know, we're kind of in a world where like, what's the path of least resistance? Like, if I've got low back pain and I can take a pill, I'll do that. And if the pill doesn't work, what's the next thing? And it sounds like this cold laser, if we can, after a couple of weeks of sessions, feel a lot better. That's not bad. Now, is that procedure covered by medical benefits? I'm
Yeah, so
curious.
this is so some of the hurdles we've had. The as Just like if a physiotherapist would use TENS or traction on you, it's a physiotherapist receipt, the same as a RMT receipt. The laser's included in my treatments. So if you're covered with an extended healthcare plan, yes, but OHIP does not cover it.
Okay, okay. And what can I ask what the cost is for somebody that comes in without benefits and without OHIP covering
Yeah,
it?
so it's $85 per treatment. Right now, RMTs, at the point right now, we're charging HST, which is on the Parliament floor right now, I believe, because we are the only allied healthcare group or um, healthcare group in Canada that has to charge HST. So
That sounds very Canadian.
yeah, so actually we're getting a lot of. I just got a note from our association, and um, um, Krista Freeman is very much behind this, so it's going to get pushed through fairly quickly, we're hoping. So anyway,
Okay,
so it's $85 at this point with tax. Hopefully soon it'll just be straight up $85 per session, and
okay,
sessions last anywhere from probably about 45 minutes to an hour.
okay, okay.
Okay.
Good to know. So you're obviously running the business and you're also, helping patients. How do you find that balance? How do you strike the balance between being the entrepreneur and being the caregiver?
I don't let those two people talk to each other.
I have never heard that answer. That is hilarious.
Because really, when I'm in the mode of 100% caring for my patient, that's all I think about. And I have surrounded myself with people that do a better job at the business end of things. So then when they need me to give some input, then I put that hat on, but I try and put that hat on as little as possible. um, so, but you can't you really can't, as a specialist and really caring for patients, you can't let business cloud your mind of how you're caring for a patient. So it is tough in this. Most other industries, you can wear both hats at the same time because they kind of meet together a little better. But healthcare is a different animal.
Okay. Okay. Well, that's good. It sounds like, you've got some people to do the things that are not your strength, which, I prescribe to 100%. I'll share. There's a book that I read about a year and a half ago that really opened my eyes to that thinking. It's called Who Not How by Dan Sullivan. So I tell as many people as I can about that book because it's been a real gift for me.
Excellent. Yeah.
Yeah. So check that out. So
I'm
what
gonna-
what do you think the next evolution is for, the part of the healthcare system and wellness system that you're in right now? I know you're on cutting, you're doing some cutting edge work with the cold lasers, but where are we going next?
That's a good question. Let me start by saying I have no idea.
Okay.
But then, here are my hopes, right? Coming from a healthcare system in California to a healthcare system in Canada has been a big eye-opening thing, because growing up here as a kid, I didn't question any of it. It was just there. Then you go to California, and the time that I was there was not a lot of consideration for people that did not have really good insurance. So this brought on a culture of everybody had an RMT, everybody had a chiropractor, everybody had a yogi, everybody had a life coach. Everything was so proactive. Let's just call a spade a spade. It was proactive healthcare, where going to your doctor meant that something was really wrong. Okay. Whereas then I come to this culture of a very reactive system, I guess I would call it, where as soon as, first of all, people wait till there's something wrong, and then immediately expect it's an insurance company, so they'll seek out methods of therapy that are covered by a provincial healthcare plan. So this is kind of what I believe needs to be knocked down a little bit, where let's not make healthcare decisions based on an insurance company and what's covered and what isn't. Let's make healthcare a priority in your life, and starting with nutrition and diet, exercise, and active therapies, as opposed to waiting until this pain is so bad. And like you mentioned before, I go to the doctor, and the doctor will give me a pill or send me to a clinic to inject a painkiller, a nerve block, because I've gotten so bad. Right.
Mm-hmm.
And so my hope is, as we move forward into healthcare in a new era, that we're more proactive in Canada with our own health.
Yes. Yeah, no, I really like your thinking there. I've spent a lot of time, talking to others about this exact topic. And, I've heard it described as, the healthcare system that we're in now is more of a sick care system. Right. And that, and then I heard, I can't remember who said it. I really need to figure out who it is, because I quoted them a few times. These are not my words, but I resonate with them, that healthcare starts at home. And there's so many things that we can do ourselves proactively. And you listed a bunch of them, which is nutrition and exercise and stretching and yoga and massage and all these things that we decide for ourselves. And as opposed, because your doctor could tell you to get a massage, right? Or you could realize before you are in pain that having massage as part of your regular lifestyle routine will avoid that meeting with the doctor where the doctor says, well, go get a massage because you can barely stand straight.
Right. And let me add, massage therapy, I mean, we think one dimensional at it, but let me throw something else in. Maybe your massage therapist is the one that tells you to go see your doctor. I
Yeah.
can tell you the number of times this year. Well, I guess the most prolific in my mind right now would be I told a patient to get off my table and go directly to emergency, do not pass go, because they failed a test after I noticed pain in a certain area. I wrote a note to the triage nurse saying they failed a certain test, and the word I got back is the patient was about 2 millimeters away from a thrombosis entering venous flow to the lung. So the
And what
doctor
is that?
said,
What is that in layman's terms?
so basically, a blood clot was going to release and kill the patient. The doctor said, "Tell your massage therapist that that your RMT probably saved your life."
Wow, what an
She was
amazing
in
story.
surgery within a day, right? So that, I mean, that's a case that was maybe an extreme, but I've been treating and found abnormal skin condition and sent them to the doctor. And so we might be the forefront of finding a cancer. So these are things that people don't consider, but if you're regularly being treated by a massage therapist or a chiropractor, or you can name the different allied groups, but these people can find things quicker because we're well trained in it, that may lead to, I guess, in extreme saving your life, but at least finding a condition that can be treated quicker than average. And
Yeah.
that's just by having that team, I guess. That's the best way to put it. In California, I had a team, right? And here it seems like very you like one group might just stick within us. So I can't say enough that massage therapists should be working with physio and chiro and other nutritionists and helping each other out, as opposed to looking at each other as competition and this client is mine or that patient is mine, which in certain areas of this industry, I can I feel it.
Yeah.
We'll just put it
Yeah.
that way.
No,
Yeah.
I see it too. I definitely see it too.
Okay.
So what, like, do you think it's even possible where, like, when you look at the way society works now, that like we're gonna see somebody that without pain becomes proactive? Like, what's gonna happen for somebody to just decide without pain to become proactive? Like even my story. So in the last year, I got to another level of health than I was in the past. And I was focusing on it in the past, but like,
Yeah.
Anybody that knows me well could see that I've gotten to another level of health in the last year.
And it feels
now,
good, doesn't it?
yeah, it feels great, but it all started with, not a close friend, but an acquaintance, somebody that I used to work out with, who was my age and I thought was pretty healthy. He dropped of a heart attack. So that's what caused like, wait, I guess I'm vulnerable. What am I going to do? And I kind of made even more improvements, but without that like compelling event, like, is there anything that would change the Western thinking to actually be proactive?
Well, possibly a global pandemic,
Yeah.
unfortunately. But so you have your I guess the key element that said, hey, wait a minute, I better start taking care of myself. I'm seeing an influx right now from the COVID pandemic of, and I see this in a younger and younger group coming in just to treat mental health.
Interesting.
So as they realize that, wow, a massage therapist can do all of this for you, decrease stress and decrease anxiety, and begin to get rid of these pains that I've been living with. Let's say if you're a student at a university, you might be humped over your computer for 3 years straight or 4 years straight, and all of a sudden someone takes that away. It puts you in a new, healthier mental space. So health starts in the mind, and that cascade of wellness will translate through your entire body.
Yeah.
And
Okay.
so I do think so. The pandemic has triggered people to actually seek out therapies that they may not have sought out before. So if there's any silver lining to it.
Yeah, no, and I've heard that for sure. It wouldn't have been cool if we saw our politicians putting their health at the forefront of their
Right.
lifestyle. That would have been very powerful for,
Yeah.
for everybody, right? Because
Yeah.
they were telling us what we needed to do. And for the most part, people did what they told us to do. But if they could have been an example, I think, I personally didn't need them to do that, but I think it would have been powerful for many if we saw, let's say our Premier of Ontario really get healthy over the course of the pandemic as a way to protect himself from COVID, and also just improve life in general and prepare for the next pandemic or thing that comes in life. So I felt like it was such a missed opportunity for these politicians that really are they spend a lot of time trying to figure out how they could get elected the next time, and they spend a lot of effort and resources to do that. And this was an opportunity where that could have been very relatable, and sent the right positive message as well. So so that didn't happen, but it's
Right.
good. Yeah, it's good to hear that others are still, realizing that through the pandemic that they're,
Right.
that mental
And that
health is
very
something you need to work on.
that could have happened. I mean, I was fortunate enough to be in the United States during the Obama presidency, and you literally could watch him do that as
Yeah.
he brought in universal health care for a nation. He not only spoke about it, but became part of it, right?
Yeah.
And you could see it. So absolutely, I totally agree.
Yeah, no, that's a good reference. So I found this conversation to be really insightful. I found out about something in the health and wellness industry I didn't know about. So I'm definitely going to look at it more. For our listeners or viewers, because it's going to come out on our podcast and our YouTube channel, where can they find out more about you and your clinic?
So I have a website. It's just the davidbarkerclinic.com.
Okay,
Actually,
we'll link it up in the show notes.
There's no the in there, but I'll send you the link. Yeah, that'd be absolutely wonderful if you could do that. And if not myself, just seek out, depending on where you are, seek out a quality RMT. And as far as it goes with laser therapies, we'll put links as to what it actually is, because giving information, there's 178, I believe, different classifications of lasers. So ours is photobiomodulation, which is a really big word, but we'll link the correct research to the correct therapy.
Okay, yeah, no, I appreciate that.
Yeah.
If you share that link, we'll put it in there.
Okay, excellent.
Yeah, that's great. So the last thing I always ask is I give a choice. Is there a book you've read recently that you'd love to talk about, or some sort of entrepreneurial productivity hack?
Oh, well, I think you already hit the productivity hack for me. So, and that generally is do what you do best and hire out for everything else. That's something I learned. But a book, I think everybody should read Dr. Sanjay Gupta's Keep Sharp.
Okay, we'll link that up as well.
Okay.
Yeah, no, absolutely. Well, you've been a fabulous guest. It was great to meet you. We live in the same city. I didn't know you. We know each other now. I look forward to more conversations in the future. And I'm going to go look into the cold laser therapy. Once you send that link, a lot more, because I'm very curious about it. So, and it's good to know that where to go in Kingston.
Excellent. Well, thank you very much. It's been a pleasure.
Okay. Thanks so much.
Okay.
All right.
Take
Why don't you